Welcome to the Miscarriage Hope Desk Podcast, where we help women struggling with recurrent pregnancy loss by sharing stories of hope and interviews with experts in the field of fertility and miscarriage. If you want to download our free lab checklist, go to miscarriagehopedesk.com/labs. Again, you will go to miscarriagehopedesk.com/LABS to download your free checklist. If you want to connect with others going through recurrent miscarriage, please check out our show notes for a link to our Facebook group. Now I'm going to hand it over to your host, Laura Bowder, for today's episode.
Welcome back to the Miscarriage Hope Desk Podcast. Today we have Dr. Huong Diep, and she is a trilingual, amazing, board-certified psychologist based in San Diego, California. She has provided clinical services, assessments, and international trainings and consultations for over 10 years. And she's passionate about the intersection of gender, language, and culture, and is an ally to the LGBTQ community. Dr. Diep, thank you so much for being here with us today.
Thank you for having me.
Absolutely. So I would love to hear a little bit more about your background and how you got into this line of work.
Definitely. So I am a child of refugee immigrants from Vietnam, and who escaped, after the war. And I think growing up, there was not a lot of talk about mental health. And so it was something that I've always been curious about. And so through my different experiences of living abroad and traveling and working internationally, I just saw a common thread of, unfortunately, the continued stigma of mental health. And so I think it's just been something that I've been very passionate about, and working with the marginalized communities. And so, as you mentioned, my focus is working, with all folks, but in particular with members of the BIPOC communities and the LGBTQ plus communities. And then we add in the intersection of pregnancy loss as well, which is a trauma that is oftentimes not talked about. And so that's just been something that I have found to be very poignant and rewarding and not talked about in this community.
Yeah, I think that's really important work for sure. And at the time that we release this episode, you will also have a book that has been published, if you want to share a little bit with us about that.
Yeah, thank you. I'd love to. The book is called All the Love, Healing Your Heart and Finding Meaning After Pregnancy Loss. And it was written with a dear friend of mine, Kim Hooper, who talks about, from her experience, her personal experiences of pregnancy loss. And so it's a part memoir, part therapy book, where I came in to from the voice of a mental health therapist, and to really serve as an ally and to amplify the voices and share my experiences of working within the BIPOC and LGBTQ communities, and the impact of pregnancy losses for those communities, and how we can bring more light and support to those folks.
Yes, and we are going to be hearing from Kim Hooper on the podcast as well, so we want to make sure we keep our eyes and ears out for her too. So a question that I have for you specifically is, with the audiences that you're kind of focusing on, either in the book or in the work that you do, can you tell the listeners who may be a little bit less familiar just about what intersectionality is, and how might people think about pregnancy loss kind of through that lens?
Yeah, great question. Definitely intersectionality is something that's kind of become a little bit more of a buzzword, these days. And what year are we? 2021. But it was coined in actually 1989 by Kimberly Crenshaw, which it's a term that examines how different systems such as race, class, gender, and other identities intersect with one another and potentially create overlapping systems of discrimination and disadvantage, right? So basically, it's just this idea that all oppression is linked, and that everyone, all of us, we have our own unique experiences of discrimination and oppression. And so if we add in the intersectionality piece of looking at the different communities that I work with, and pregnancy loss, we know that despite pregnancy loss happening 1 in 4 pregnancies, that it is still something that is or has been so taboo to talk about. And still so much stigma, and shame of talking about it and getting support. And so if we look at, on top of that, the different layers amongst the BIPOC and LGBTQ plus communities in terms of their own previous traumas and oppression, and then you add on the potential lack of understanding from medical providers, misgendering somebody, lack of family support, et cetera. That just adds on additional layers of stress and potential trauma.
Mm-hmm. Yes, definitely. And, it's already such a difficult experience. And then to feel like there are these other potential barriers to treatment or to just having somebody understand what you're going through, that can be really difficult. So, what have you seen as far as like some of these impacts? So we're talking about the intersectionality of pregnancy loss, but then as you mentioned, we're talking about more marginalized groups. Like we're talking about people of color, people who maybe are consider themselves, like you said, you don't want to be misgendering people, or they consider themselves to be part of the queer community. Like how what are some of those additional impacts that people who aren't a part of those communities or even medical professionals themselves may not be taking into consideration?
Oh yeah, I mean, there's so many potential factors, and I'm sure I'm probably gonna, miss out on some of them. But I mean, one of the first ones is, just even the logistical, right? I think for some of the folks who, let's say, you are in a relationship with, as a woman, with another woman, right? That there's going to be the logistical aspects of getting pregnant, the medical component to this, the financial, component, the potential discrimination that you experience, at the doctor's office. I mean, even simple questions that my clients have shared with me of, oh, where's your husband, right? I mean, we live in a very heterosexual, cisgender, normative world of that, just having these certain assumptions, right? And that maybe in silo of just one individual moment or oppressive comment would be okay, but we know that it's not, it's compounded upon each other, and that it just happens over and over again. And so it's that cumulative effect that produces a lot of stress and concern, for my clients.
Yeah, well, and I imagine too that there's, like you mentioned, with the compounding effect. So it's not just the fact that maybe people are feeling stress about having to go to a doctor or trying to work through a loss, but it's then linked to all of these other past experiences of a doctor who didn't believe them or didn't take them seriously or disrespected their gender, their sexuality, their race or ethnicity. And that really just builds on itself. And I mean, what, from like a psychologist's point of view, what is that like for people does it discourage them from getting care? Does it discourage them from maybe starting the families that they would otherwise want to start?
Yeah, great question. I mean, definitely when we look at the US, like for example, let's say amongst my transgender clients, that amongst within the last US transgender discrimination survey, we see that 60%, so 60% of trans folks have refrained from going to a doctor for fear of discrimination, and that they have said that 1 in 4 providers have tried to convince them that being transgender was wrong. And yeah, so I mean, I'm just going to let us sit with that statistic for a second, right? So, I mean, you can imagine even from basic primary care that if you're not going in for routine checkups, that can, lead to longer, potentially, not identifying potentially acute or chronic medical concerns. And that, on top of that, potentially going into an OB-GYN office. And, even from the first moment that a a client steps in the office, just the way the office is decorated, the posters on the wall, right? The medical receptionist and how they address you, are they using the correct name and pronouns, and even then the paperwork, right? Because if we look at paperwork, and it's something I've become more acutely aware of, is so oftentimes when there's that gender box, there's only two options still, right?
True,
Or
yeah.
even looking at different boxes of, like they'll say mother and father or something like that, right? So I think it's these little things that I know we all have so much to think about already in a typical day. And that's some of the pushback I get from medical providers when I work with them in terms of creating a more affirming office space, but also knowing that it's, again, these little cumulative things that add up and are basically going to add additional harm. And actually, yeah, you're right, psychological harm, to clients, and perpetuate the idea of this internalized, discrimination that a lot of my clients have towards, themselves, of feeling less than.
Yes. So I guess what are the what is the question I'm trying to ask? What are, so we've talked a little bit about, okay, we have a cumulative effect, we have intersectionality that we're looking at through here. So when we're talking about someone who is experiencing miscarriage, they've experienced recurrent pregnancy loss, we're talking about that trauma put together with these kind of cumulative traumas of knowing that, like, okay, when I go to the doctor, like, they're not going to address me in the appropriate way, or I'm going to have to sit in this room that is pink and full of pictures of cisgendered women with their, beautiful babies and that kind of thing. I guess what would your advice be then? We have things that the doctor's office itself needs to work on for sure, and the medical community at large. For someone who might be listening to this episode and thinking like, yes, I fall into one of these marginalized communities, and you're explaining every reason why I don't want to go to the doctor, why I'm hesitant to think about starting a family. What are some things that they can think about? What are some things they should be aware of? How can they find support if they're feeling alone in this experience?
Yeah, definitely. Great question. And I think
Took me a while to get there. I apologize, but I got there.
No, I mean, I think I recognize that we're talking about very heavy, I mean, in general, right? In terms of pregnancy loss and miscarriages, but yeah, we add in, so many layers, and given our current socio-political, climate right now, it can just feel really overwhelming, right? So I just want to acknowledge that there's no like clear cut path, right now. So as listeners are, just sitting, of all of this, just being like, okay, yes, it's like we're in the fog right now. And so sort of where next to go. And I think that of just even for ourselves, and that for listeners who maybe don't identify as part of, these communities, I think maybe just taking a second to really think about their own gender identity, right? And their own how they have come to understand, gender identity, sexual orientation, whatnot. And I think, even for myself as a, woman of color, that I always check sort of my own privileges, right? Of thinking about, that I am always very upfront with my clients that, hey, I identify as cisgender, I identify as heterosexual, so I don't have the lived experiences. And I also am very upfront that I have not, to my knowledge, experienced a pregnancy loss, right? But I have the, clinical research experience, and I think the curiosity and the genuine empathy to want to understand. And I think that comes across to, my clients and to the community that, hey, like, I'm an ally and I'm here to learn more, and to know that, yeah, I might make mistakes and maybe not use the correct terminology, at times, but I think if there, is the desire to learn more, right? So I think if that's something that, if there are listeners out there that's like, oh my gosh, this is so much, where do I even start? And so then for those who are within the community, I think to know that there are definitely, support and increased knowledge, out there in terms of thinking about, that there are providers who are gender affirming and who want to learn more. And that we know amongst, let's say, if we're looking at the medical side, that in medical schools and trainings, that there are additional trainings, out there, and that is now part of the curriculum. There's the Pregnancy Discrimination Act, there's our new administration that has, signed, new laws, into effect. There's definitely legal protections, right? But we also know that with legal protections, it doesn't necessarily mean enforcement of those legal protections. So I think part of this is I think having for, folks who are part of this community, I think finding support within, the community as well, and knowing that there are others who want to serve, as an ally, and that who want to learn more. I just think sometimes there is sort of that fear given the cancel culture that we're also living in. Today. So I don't know if that actually answers your question. But.
Yes, no, it does. And I think that that's such a good point too. Like I want to affirm that there are plenty of providers, medical providers, mental health providers who are affirming, who want to learn, who are open-minded. But I think there are just so many things that are ingrained in our culture in our world that we don't even think about, like you mentioned, the medical forms and just like, this is an OB office, so we're gonna put up some pictures of women and babies on there. And I think that there's just so much that we don't always think about or question if we are kind of part of that privileged section of society that doesn't have to think about those things. And so I do think it's a really important thing to consider. So along those same lines, what would you think are some maybe more unique challenges that are facing these folks, whether they're part of the BIPOC community, they're part of the LGBTQ plus community? So we're talking about couples, we're talking about families, we're talking about whole communities of people that have all of these extra things that they have to worry about when it comes to medical care, when it comes to what to do if they want to get pregnant. What are some of those unique challenges that maybe we could all think about?
Yeah, I think, just to highlight some of the ones that I have helped my clients navigate and that I've heard, in my office is for some folks who are part of, the queer community, the LGBTQ plus community, that for some folks, having a child is, whether consciously or subconsciously, a way to be part of, everyone else, right? That of, wanting to bring life into the world. And that there is, for some folks, they have shared with me this sense of, legitimacy. Like now people are really going to see us as a real family, right? And that maybe there won't be as much discrimination or aggression towards us if we're carrying a child, or not carrying a child in terms of, gestationally and then literally carrying a toddler around or whatnot. And so I think for some of my clients, there's this sense of, that grief is extra compounded as well, that of, losing a child and having that pregnancy loss and then losing that sense of belonging, right? Of being that, and I think in our day and age, there's still, those who are parents and those who are not parents. And that's it's such a, as a person who is a non-parent myself, that is just something that, it definitely makes me aware of when people are like, oh, do you have kids? Right. And I know that most of the time it's a pretty innocuous question. But I think for me, I use that experience of how I feel in that moment, to then sort of have empathy for, and again, not at all that I can empathize with walking and having the experience of being part of that community. But that of just a little bit of, feeling a little bit, quote unquote, left out. Right.
Sure.
And let's see, another one could be, let's say for my trans my trans male. So those who were born assigned female at birth, but have since transitioned, to their gender identity as male, but still have the female parts where they can get pregnant. So if we look at just, I don't want to go too into the weeds with the medical stuff, but basically one would have to get off testosterone if they're on testosterone in order for their bodies to reproduce, or even take additional estrogen in order to get pregnant, right? So we can imagine that we know for some transgender folks, they experience gender dysphoria. So that's like the anxiety, the distress that their outward appearances or gender identity does not match their assigned sex at birth. And so you can imagine sort of this double-edged sword of really wanting to get pregnant, knowing that you're going to have to go off the hormones that helps you, right, become more affirming in your gender identity,
right,
and then to then experience a pregnancy loss and all the rush of hormones, right, that come, after that, which I'm sure, you can empathize with in terms of just the hormonal changes.
Yes, for sure.
Because going through transition and my clients and I talk about how, anytime you introduce hormones and hormonal replacement therapy, that's basically going through a second puberty. So now they're essentially going through a third puberty.
Right.
Which I don't think
nobody wants to sign up for that,
do
right?
that. Yes, not willingly. Right.
Yeah.
And then I think too of just, it's that we call that, there's a term called disenfranchised grief, where I think for a lot of my folks, my clients really believe it's like, oh, do I deserve to feel this sad and this, this trauma, and of not, and other folks maybe not, and even despite, their family and friends, trying to say the right things. All right. We have a whole chapter in the book about all the things people say that, are well intentioned, but we know there is a difference between intent and impact. All right. So even if you didn't mean to step on my toes, it still hurt that you stepped on my toes. And so I think, it's just, you can only imagine sort of the double, triple, quadruple whammy of just all these different factors.
Yeah. Well, and the disenfranchised grief is it's a very interesting topic for this, in relating to pregnancy loss, because I think in general, people who experience a miscarriage or pregnancy loss don't always share that with other people, if they weren't very far along in the pregnancy or hadn't announced the pregnancy, then I think it's pretty rare that they would then announce a miscarriage widely. So then you're kind of just going through all of this grief with the loss, just you and your partner, maybe you and a small group of friends or family. But you don't kind of widely share that with your wider circle. So yeah, I can only imagine how much more amplified that is when you're looking at it through this intersectional lens of like, what are people going to say to me, even with good intent, to if I am part of a homosexual couple, or if I am trans, or if I somehow don't fit into that little box of what people think that, a family is. How on earth do I share this information, share my experience, and hope to get support from other people after I share this?
Yeah, definitely. And I think one of the things that runs across the board, whether you're cis or trans or, whatnot, is just unfortunately still this self-blame, right?
Yes,
and this
absolutely.
guilt of what did I do wrong, right? And that's something that I just want to hold space for everyone, that it's still, this one cuts across the board of what did I do? And that's something that I really hold space for my clients and friends and whomever is experiencing this, that to know that there's nothing you did, but I think especially us wanting to feel a sense of control in this crazy world that we live in, it's easy to inflict that self-blame and self-flagellation, which is, it just adds even another layer of pain to the experience. And that I often relate it to the second arrow of pain, which is a concept in mindfulness meditation that says the first arrow is the pregnancy loss, right? Let's say in this case, it's already so painful, but the second arrow that we inflict upon ourselves is then this potential questioning and doubt and self-flagellation of just what could I have done differently, and what did I do to cause this, that adds on just that extra layer of pain.
Hmm. Right. And I think it's such an interesting kind of juxtaposition because of course we understand on the one hand, like we've been talking about, there are certainly these additional barriers and these things that are different experiences. And then on the other hand, here, there are also just universal truths about pregnancy loss that everybody who experiences this will go through to some extent. And, there are just different personalities, different ways that people cope with these things, regardless of, their gender identity or racial identity or the community that they belong to. And so it's important to keep that in mind as well, that whether it's, somebody who was able to get pregnant, quote unquote, the old fashioned way, whether it's somebody who had to go through IVF to get pregnant,
Mm-hmm.
somebody who is expecting a child through surrogacy. I mean, there are so many
Mm-hmm.
different ways to create a family, and every one of those avenues, you can experience a loss that is extremely difficult to work through. And again, you may not feel like your loss is as valid if it's not the way that most people are talking about a pregnancy loss.
Definitely. I think there's still, if we look at across social media or the internet, when you Google, let's say, pregnancy losses, there's still a very certain idea of what it looks like, or if you think, when you think of the idea of family, right, that they're I think it's still a very much like a mom, a dad, and 2.5 kids, and
Mm-hmm.
whatnot. And so I think, I think my mission has been just to amplify certain voices, marginalized voices that using sort of my position as a doctor, as a mental health provider, as somebody who is able to share my expertise with others, of just, I think, knowing that um, we are all in this. I think that common refrain during this time, we are all in this together, but definitely for some folks it's just going to be just because of the way different infrastructures and society has been, that it's just going to be a lot harder. And especially if we look at even with the Black Lives Matter movement, and right now with, I would be remiss not to mention right now API hate that is happening right now in this current day,
Yeah.
as we're recording right now. That just adds on. You can just imagine, it just adds on an additional layer. And research has shown that Black women will have more discrimination and potentially pregnancy-related concerns
Yeah.
because of the lack of training and of medical providers, and or just maltreatment.
Yes. Yeah, I've definitely seen those statistics. And it's discouraging, it's disheartening for sure. But I do also, really appreciate people like you who are coming on and willing to share your expertise and just encourage people to think about things differently, because I think so much of it is just, especially I'm not going to use the pandemic as an excuse, but we can just get so wrapped up in our own little world sometimes, especially when we're just like, here we are with our families, with the same people all the time. And in the echo chamber of whatever we happen to be paying attention to. And so I think it's so important to continue to learn and expose yourself to new things and really think about the privileges that you do have and what you can do to support others. I think all of that is just so important to continue to think about.
Yeah, no, and I thank you, and for inviting, me and Kim on to help amplify our voices, right? And this is kind of how it starts, is just by, us holding space for each other, and sharing our stories. And, so I really, appreciate the opportunity, because if not, then it's very easy to kind of get caught up in just sort of our immediate, day-to-day stuff. So thank you.
Definitely, definitely. So in general, if we are thinking about couples who are experiencing pregnancy loss,
Mhm.
do you have advice just as far as working through that as a couple?
Mm.
Are there any differences to think about, whether it's, a loss, kind of like I mentioned before, like a loss that you were able to get pregnant and then
Mhm.
lost the pregnancy versus having to do fertility treatment and then losing the
Mhm.
pregnancy, or surrogacy and losing the pregnancy? What are your thoughts about just working through that as a couple?
Oh man, yeah. I mean, we know that even in, let's say, heterosexual cisgender couples, that that stereotypically, right, that potentially the male partner is not going to be able to be, as, let's say, empathic, or whatnot. And so I don't want to make a blanket statement for those couples, but we do know that there is potentially a lot of conflict, and that unfortunately what also happens too is that there potentially could be a separation or divorce for a lot of couples after going through especially multiple pregnancy losses, and the stressors on the couple and on the family overall. And so if we add in, again, the stressors of within marginalized communities, that we can see that yes, potentially there could be a financial strain that is just going to add extra stress, to a couple. And what if one partner wants to keep trying and the other one, just doesn't? Or, everyone, like you mentioned earlier, everyone reacts so differently, to trauma. And I always tell people that you're having a very normal reaction to an abnormal event.
Mm,
Right. So however someone reacts, I think for some people want to talk about it, all the time. Some people don't want to talk about it. Some people are like, well, let's just keep trying, and becomes something on the to-do list, right? And some people are
right.
like, no, we're not talking about this like ever again, and I don't want to try anymore, and it's too painful. Because for some people it just brings up too many triggers. And so I think navigating that as well. So I do work with couples of sort of helping them navigate that space. And we all grieve so differently, and that a lot of times there is a lot of guilt from maybe the non-gestational partner of just like, I don't really understand, I know that they're in pain and this hurts me too. But then there's also this disenfranchised grief for the
Right.
non-gestational couple, or sorry, non-gestational partner, right? Because being like, but I didn't carry the child. Or yeah, you can even imagine for two people who are their surrogate experiences a pregnancy loss, right? And maybe they had not told anybody that they were going to have use a surrogate. So how do they navigate that? And so, and that and then another scenario is, let's say, amongst a female couple, is one partner has been able to have a pregnancy, a full-term pregnancy, and the other one experienced a pregnancy loss. So there's also that a little bit of jealousy or resentment, or whatnot. And so there's just so many different permutations of different dynamics that I would
Yeah.
not be able to cover it all. But I think it's holding space for each person, and what they're experiencing, and trying to navigate that, together, and to help be a bridge oftentimes, between the two of them, and to figure out, yeah, what would the next steps look like, and how do you heal, like, yourself, but also, together, and then within the community.
Hmm. So I imagine, with the work that you would do with a couple, it would be really important, first of all, communication, open communication between the couple, and then also just making sure that each person feels supported and has like a coping strategy that works for them, even if it might be a little different than how their partner is coping.
Exactly. And I think I help sort of interpret, being like, hey, you each are hurting, you each are in pain, but this is how this person is doing it, and this is how this person is doing it. And what do you need sometimes to see from your partner, right? Because
Mhm.
oftentimes the person's like, I don't want to feel like I'm grieving alone. And the other person's like, I'm grieving too, just not in the way you're grieving.
Mhm.
Right. But I think oftentimes we want that extra validation. And of course, especially from our partner, to grieve in the same way we are, right? So I think it's
Sure.
really finding that balance of seeing like, okay, so I don't know, sitting there and watching Netflix all day might be a form of grieving for one person, but for another person, that's just going to feel like too much, let's say. So how do we, find that and balance, and for each person, to communicate to the other, like, I'm grieving too. I'm just doing it in a different way. It's almost like the love languages, right? Of like it's almost, I guess, maybe, I don't know if there is a research on this, but a grief language, perhaps, right? Of, yeah, what are the different grief languages, and how can you communicate your grief language to your partner?
Mm-hmm. I think oftentimes there's kind of a split or a dichotomy, like one partner will be more outward, external with their grief, and then the other partner will feel like, okay, I have to be strong because this person is falling apart, which then leads to that cycle of what you were just saying. Like, they think, well, I don't want to be grieving by myself. Why aren't you more upset about this? And yeah, I can definitely see that would be a pretty common pattern for couples of all kinds.
For all couples. Yeah, exactly. For all couples, no matter what the makeup is.
Because we want to be supportive to our partners. And I know, like, for my husband and I, not necessarily about pregnancy loss in particular, but just if one person is really upset about something, the other person will feel like, okay, like, I got to step in and make them feel better, or be really supportive, and just, and it can go back and forth depending on what the issue is. But I do think, yeah, in this particular case, it can show itself more strongly because you have, in many cases, one couple who was the gestational carrier, one couple who was, or one partner who was not. So there's that kind of like very pronounced split in experience there.
Definitely. And a lot of times it even comes down to just really naming it and having very concrete examples, right? Of, working with a couple and, being like, what can your partner do? Like, it's just, what are, like, a few things that concretely, right, that your partner can do to show you that they are also grieving and supporting you. Because I think oftentimes, the other partner, we keep getting partner and couple confused. The other partner might feel like helpless. So they're like, just tell me what to do. Right. And so sometimes it's just helpful to be like, okay, can you check in on me and ask this, or, whatnot. And I think for some people it feels a little contrived or fake, but I'm like, you know what, maybe in the short term, that's just what you need to do to navigate that, because who wants to feel alone, especially after a traumatic event? I mean, part of this is we all want to feel heard and seen and validated, right? That's just a basic human need.
Absolutely. Yeah. So I want to give you a chance to let the listeners know where they can connect with you online. I don't exactly know how we'll edit this together yet, but I'll let Kim in soon because she's on the line here. But I'll give you a chance. We'll do like a wrap up for you, and then we'll see how we fit that all together. But I'll let you do that. So yes, let the listeners know where they can connect with you online.
Yeah, they can connect with me at my website at drhdiep.com. So drhdiep.com. And Kim will also share all the links to our social media stuff for the book. And that, I really do hope that folks can, to really check out the book, because again, it's really written in a non kind of jargony, language, and that the sections are really broken down where you can kind of look through the table of contents and kind of just go straight to a section and kind of just get some, quick support. And so, yeah, I hope that, our goal when we were writing this, actually in the very beginning of the pandemic, which we were not expecting, was just, to provide a safe space, so that, all folks can feel, some comfort, during these times.
Great. Yes, I really appreciate you coming on and sharing all of your expertise. The book is going to be an incredible resource. So we will have all of the links in the show notes. And thank you so much for coming on and chatting with me today.
Yeah, thanks so much for having me.
Thank you for joining us today. And don't forget to check out our show notes for details on joining our Facebook group and for following along on Instagram. If you would like a free recurrent pregnancy loss lab checklist, go to miscarriagehopedesk.com/labs. Again, that's miscarriagehopedesk.com/LABS to get your free downloadable checklist. And for even more resources, visit the Miscarriage Hope Desk website, where we have stories of hope plus an entire library of evidence-based research articles related to fertility and miscarriage. If you enjoyed this episode, I would so appreciate it if you rate, reviewed, and subscribed to the Miscarriage Hope Desk podcast. Your ratings and reviews will help others to find us. I want to wrap up by saying that if you are going through a miscarriage, my heart goes out to you, and as difficult as your experience may be, I want you to know that you are not alone and that you will find a path forward.